Hi everyone, I'm here to give you a persuasive speech on why I believe you should get annual dental cleanings or just at least get evaluated by a dentist at least once a year. I'm currently a student in the dental hygiene program on campus, so oral care and things that go along with dental cleanings and appointments are very important to me. So, what occurs at a dental visit? There's a few things that you might not even know your hygienist or your dentist is doing that we tend to check at every appointment. So, you get your full mouth cleaning where we go through and take off all the bacteria that's built up and the plaque, all of that. We also do oral head and neck cancer screenings, and that's something that we're not typically very vocal about, but it's something we check at every appointment since oral cancer is so common. We take x-rays, also known as radiographs, to evaluate your bones and your teeth and everything kind of going on in your face. There's also restorations of decay or injured teeth, possibly removal of teeth, anything that needs to be done to improve your oral health. And then also there's fluoride application, which some people are not a fan of, but fluoride really works to remineralize your teeth, which makes it important for when you're not getting your yearly cleanings. So, the benefits of these annual visits and getting the full cleaning that you need. So, it treats current diseases you have going on, and it also helps to prevent further disease or progression of disease. It gives the hygienist and the dentist and the patient as well an assessment of their oral health, and it also improves not only your oral health but your overall health. For example, we talk about nutrition within the program, and if you have decay throughout your whole mouth and you're in a lot of pain, you're not going to be able to eat certain foods, which then could mean you're not getting enough nutrients for your body. So, your oral health is very closely linked to your systemic health, and not many people realize that. And I recently went to a dental convention and sat in a lecture about oral cancer. And so, over 50,000 people are diagnosed with oral cancer yearly, and most of those are caught in the late stages. So, if we kind of reflect back to how cancer prognosis has changed over time, oral cancer is one of the least changing beneficial prognosis because people are not visiting the dentist annually, so these cancers are not being caught in their early stages. So in 2010, the survival rate was about 52%, and 9 years later, it had only gone up to 68%, where other cancers had grown 20 to 30%. So while 68% survival rate is still relatively high, there is still also a high mortality rate for oral cancer. And the thing about oral cancer is a lot of it is extremely preventable and has to do with just your habits, whether you smoke, drink, brush your teeth every day, that kind of thing. So it is important to go every year just so that way you know you don't have any cancer or any kind of infection or conditions going on. So the cons of not getting a yearly cleaning, obviously, if you're sick and you don't go get it treated, that disease is just going to progress. So same with your teeth. If you have an infection going on under your gums, such as gingivitis, if you don't get that taken care of, it will just keep progressing, and that can lead to cavities, tooth loss, and or tooth pain. Can also lead to delayed cancer treatment if by chance you do have some form of oral cancer, and also it can just lead to infection and disease that can spread throughout the whole body and not just stay within the mouth. So, for your oral health and your overall systemic health, it is extremely important to at least go get a yearly checkup the same way you would at your doctor and really just protect yourself from any diseases, whether preventable or not. So, I believe that is why everybody should go get an annual dental cleaning.